Good day. Our topic is skin cancer. We're from group 401. Our team members are Ivette Rodriguez Vargas, Sergio López Valderas, Valeria Jimena Pérez Contreras, Gael Patricio Gaitán Botello, Ricardo Andrés Beliz Salgado, and myself, Pedro Andreu Cortés Almazán. Our teacher is Ricardo León Acosta Garcia, and we hope you like our presentation.
What is skin cancer? Skin cancer is an abnormal growth of skin cells. It generally develops in areas that are exposed to the sun, but it can also form in places that don't normally get sun exposure. The two most common types of skin cancer are basal cell and squamous cell carcinomas. Are highly curable but can be disfiguring and costly to treat. They are most likely to develop on areas of your body that get the most sun, like your head and neck. They are less likely than other forms of skin cancer to spread and become life-threatening. Melanoma is the third most common skin cancer. It's more dangerous and causes the most deaths. These cells are known as melanocytes. Begin moles formed by melanocytes can be cancerous. The majority of cases of these three types of skin cancer are caused by overexposure to ultraviolet light. The Mako is a special type of cell found directly under the epidermis. These cells are very close to the nerve ending that receive the sensation of touch and can participate in the sense of touch.
Preventions. The first one is avoiding to expose to the sun during midday because the sun rays are strongest between about 10 a.m. and 4 p.m. So we should schedule outdoor activities for other times of the day, even in winter or when the sky is cloudy. A second prevention could be to wear sunscreen all year round because unless sunscreen don't filter out all harmful UV radiation, especially the radiation that can lead to melanoma, it play a major role in overall sun protection. We also could wear protective like because sunscreens don't provide complete protection from UV rays, so cover your skin with dark, tightly woven clothing that covers your arms and legs, and a broad brim hat, which provides more protection than a baseball cap or visor does. Um, the other one is to be aware of sun-sensitive medications because some common prescriptions and other drugs, including antibiotics, can make your skin more sensitive to sunlight. Also, check your skin regularly and report any changes to your doctor. You can examine your skin often for new skin growth or changes in existing moles, freckles, bumps, and birthmarks, and also avoiding the use of tanning beds because lights used in tanning beds emit UV rays that can increase your risk of skin cancer.
Now we proceed to the statistics. In 2020, there were 2,051 new cases of skin cancer in Mexico. And since 2015, there were 6,032 cases that were not cured from that age, meaning that the people have been having skin cancer for 5 years. That is more people that got cancer in 2020, meaning that they need to be cured or else it might get worse.
The risk factors for skin cancer are various, but some of the most common are having lighter natural skin color, family history or heritage of skin cancer. This is referred to when you have a parent or a relative that had skin cancer, you could have it also. So you need to be careful with that. Also the age. The older you are, the more in risk you are to get skin cancer and high exposure to UV rays.
The most common treatments for skin cancer are surgery. Most skin cancers are treated with surgery, especially basal cell and squamous cell carcinomas, which are typically removed by a dermatologist as a part of an outpatient procedure. Topical treatments. These non-surgical forms of therapy include photodynamic therapy, topical chemotherapy, and immune response modifiers. Chemotherapy. Chemotherapy may be an option for patients with advanced skin cancer, such as Merkel cell carcinoma that has spread elsewhere in the body. Radiation therapy. Radiation treatments may be recommended after surgery to kill remaining cancer cells in the area where lymph nodes have been removed. Target therapy. Target therapy drugs are used to treat melanoma and some non-melanoma skin cancers, such as rare cases of advanced basal cell carcinoma. And immunotherapy. Checkpoint inhibitors and cytokines are two types of immunotherapy drugs that may be used to treat some cases of Merkel cell carcinoma and melanoma.
Okay, so right now we're going to project one of the two videos, which is the first one, and then we're going to talk about the conclusion.
A stands for asymmetry. If you draw a line through the middle of this benign mole shown here, the two sides will match, meaning it is symmetrical. If you draw a line through this mole shown here, the two halves will not match, meaning it is asymmetrical, a warning sign for melanoma. B stands for border irregularity. A benign mole generally has smooth and even borders, as shown here. The borders of a melanoma, as shown here, may be uneven with scalloped, notched, or trailing edges. C stands for color variegation. Most benign moles have one or two evenly distributed colors. Having a variety of colors, including brown, black, white, red, and/or blue, may be a feature of melanoma. D stands for diameter greater than half a centimeter. Although melanomas may be larger in diameter than the eraser head on your pencil, they may sometimes be smaller when first detected. The last letter, E, stands for evolution. In most cases, benign moles are stable over time. Be on alert when a mole starts to evolve or change in any way. When a mole is evolving, see a doctor. Any change in size, shape, color, texture, elevation, or any new symptom such as bleeding, itching, or scabbing may be a sign of malignancy.
Okay, so as we previously saw on the first video, um, we should check ourselves on any type of dots or any type of moles we have on our body. As we see, it's pretty common to not know that you have skin cancer. As we saw previously on our presentation, um, it's not about if you get it hereditary. It just happens hereditary when you have melanoma, and that's when you have to get yourself checked. But most of the times you get skin cancer because you don't take care of your skin because of tan beds, as one of the team members said. Like, most of the factors are that we ourselves make it happen. Like, we do not care about ourselves or our skin. So that's why when you have problems with your skin or see any type of irregularity in your body, you have to go check it. And to prevent this type of skin, which should be taken more seriously because it affects all throughout all your body. So thank you for your attention. We hope you like it, And in the next slide is our references. So yeah, thank you.